Yes, no, possibly. All of those options are possible, depending on the quality of your skin, your age, the amount of breast tissue you have, the size of the implants. It is important that you're assessed properly by a plastic and reconstructive surgeon. It's important we have the previous details available, the size of the implant if known, the volume. After a full careful examination and histories, investigations may need to be performed, for example, an ultrasound or possibly an MRI scan. Once all those things are taken into combination, a plastic surgeon will be able to advise whether it is possible just to simply remove the breast implant. And normally if that's performed, you may remove the capsule, the scar layer around the breast implant, either partially or completely. In a lot of patients, that may be all that's required because you're actually reducing the weight of the breasts, and the natural spring and recoil of the breast means that they may go back to a normal position. In those situations where there have been very large implants or where you have very little breast tissue, it is possible that the skin may have stretched to the point that it may leave excess deflated breasts that may require a lift or a mastopexy with repositioning of the nipple and possible reshaping of the breast. Depending on the nature of your exact situation, this may be able to be performed as a single stage operation at the time of removing the implants, or as a two-stage operation where classically the implant and the capsule will be removed first. You allow the breast to recoil, reassess, and then do a lift. From experience, I've found that more often than is felt to be the case, most patients who feel they need a lift end up not needing a lift. And if they do need a lift, you'll tend to find that the amount of scarring is less. A lift may require a scar around the nipple, a vertical scar, and possibly a scar underneath the breast itself. And you tend to find that by waiting and staging it as a two-stage operation, you may be able to reduce the amount of scarring and incisions that are required in order to obtain the maximum lift, because with time the skin will retract to a certain degree and recoil, meaning that there's less skin excision required.